Dear friends, I am Dr. C.J.K. Shomurthy, geriatrician practicing in Shumoga, Karnataka. I welcome you all to my geriatric medicine channel. Today we will discuss about the osteoporosis, a growing concern in the geriatric population. Osteoporosis is a condition which occurs physiologically in the elderly, resulting in a decreased bone mass and bone strength. National Institute of Health (NIH) Consensus Development Panel has defined the condition as a skeletal disorder characterized by compromised bone strength predisposing a person in an increased risk of fracture. So such a people will undergo incre- uh, possess increased risk of fracture. Osteoporosis includes following abnormalities. Porous means bone. Porous bone means it's a brittle bone. Bone fragility and increased risk of fractures do occur. It is a silent disease. Bone loss without any symptoms. Structure and functions of the bones. Morphologically, the bone consists of two parts. Cortical, that is the compact portion of the bone, and trabecular, the spongy portion of the bone, which is inside the bone. Cortical part comprises 80% of the total skeleton. Chemically, the bone comprises of organic matrix and inorganic mineral. Organic matrix, which forms one third portion of the bone, comprises of collagen 90% and mucopolysaccharide. Inorganic mineral comprises of two-thirds of the bone, and it consists of calcium hydroxyapatite and other minerals such as sodium, potassium, magnesium, etc. Bone performs mechanical and biological function. You all know about that one. Since childhood you have been learning about that one. Mechanical functions include the support, protection, and movement facilitation. Biologically, it takes part in mineral storage and storage of blood-producing cells. Cells of bony tissue. The cells of the bony tissue comprises of osteoprogenitors that form the osteoblast cells. The main cells are osteoblasts, osteocytes, and osteoclasts. Sorry, which form, maintain, and absorb the bone cells respectively. Osteoblasts are derived from the mesenchymal stem cells in the bone marrow. Initially, they secrete an organic matrix, which is then calcified extracellularly. This is very important. Bone resorption is performed by osteoblasts, and now it is osteoclast. Osteoclasts are multinucleated giant cells derived from homeopathic system. They secrete hydrogen ions which dissolve minerals. In addition, they secrete proteolytic enzymes and cathepsin that dissolve the matrix also. Cortical and trabecular bone is constantly turned over by two processes named modeling and remodeling of the bone tissue. During modeling, new bone is formed at a place different than the place destroyed. It is responsible for a alteration of the shape of the skeleton, especially in children. Remodeling in the form of destruction and formation takes place in the same site, and then that location is used for maintenance of repair in the adults. Osteoporosis. The rate of formation of bone is more than its shedding till the age of 30 to 35 years of our life. Then the bone loss exceeds its formation, and there is reduction, in the size of the bone mass. It results in weak and brittle bones. The bone can fracture even with mild stresses. The common sites for such fractures are hip, the spines, and wrist. Spines are the backbone, bones of the back. For diagnosis of osteoporosis, World Health Organization WHO had laid down the following criteria. Osteoporosis, a value of bone mineral density, that is BMD, more than 2.5 SD, below the young adult mean value. Severe osteoporosis, a value of for BMD less than more than 2.5 or below the young adult means plus one or more fragility fracture. Role of calcium and vitamin D is very important. Calcium is the fifth most abundant element in the body. 99% of calcium is found in bony skeleton, that includes bones and teeth. Only 1% is found in extracellular fluid and soft tissue, calcium ions. Calcium is necessary for neural excitability and release of neurotransmitters, muscles contraction, cardiac function, coagulation of blood, and maintenance of integrity of the membranes. Vitamin D helps in maintenance of calcium and phosphorus. Homeostasis facilitates absorption of calcium from intestine, helps in mobilization of calcium and phosphorus in bone and in maintenance of cell membranes. Dear friends, this is about uh, what is that called a little bit knowledge about osteoporosis or bone. In the next chapter episode, we shall consider classification of osteoporosis. Thank you very much, dear friends. Subscribe it, like it, and share it with your friends. Thank you very much. Jai Hind, Jai Karnataka.